So I was asked to speak to the nurse about parvovirus, which is something that is one of my favorite things to treat. It's what my clinical research was on, and I feel I have a decent grasp of the disease. So first of all, parvovirus is a disease, not exclusively, but almost exclusively of puppies. And so it's always in dogs, generally from 6 to 7 weeks up to about 10 or 11 months of age is typically the age range in which we see it. We've been seeing it in much younger dogs here, and then more recently we've actually seen it in quite a few dogs that are older than 9 months. But those are definitely generally outliers. There are certain breeds that are thought to be represented. Those would be Dobermans, Rottweilers, German Shepherds, and American Pit Bull Terriers and their ilk. Those dogs typically are overrepresented. It is a viral disease and such there are no specific therapies for it. It's a really interesting disease though, because we know, or it's been shown pretty well, that the illness that we see in these dogs is actually a function, not so much of the virus, but of all the secondary changes that occur from bacteria that present a challenge for the dog's immune system and for managing their inflammation. So a couple things, really important things are, so canine parvovirus is evolving, I guess, for lack of a better thing. So it went from CPV, or canine parvovirus A, then to B, and then to B subclat 2, and now it's the predominant, I guess, clade, or the strain that we see of the virus is CPV2C, which is the C variant of canine parvovirus 2. And if you look online, there's, be careful what you see is people are, the lay public is saying, oh, the current vaccines don't get it, puppies are dying more. There's no evidence that the current vaccines do not get this CPV2C. There is no evidence per se that it causes more severe illness or that the mortality rate is any different. I think most of us who've been treating parvo for as long as I have recognize that the duration of hospitalization for our patients is increasing. And so typically these dogs would be out of the hospital with aggressive therapy in 3 to 4 days. Some are, but there are a lot of dogs now that are still here on fluids at 5 and 6 days, which is I don't know if that's a result of the viral strain, but it certainly is something that we're seeing a lot more of. And so how do puppies get this? Almost always it's fecal oral. It is hardy. It is thought to last, in the environment, in the soil, for up to 6.5 months. That being said, fully vaccinated pets on that soil are not especially in a lot of danger or peril being exposed to it, because once the soil desiccates, it is very difficult for those dogs to acquire. It's almost always fecal oral. Oronasal is described and it's documented, but it is almost never the case. From the time that puppies are exposed to the time that they will have viral shedding in their stool, it's about 3 to 4 days. The onset of clinical signs, typically after exposure, it's wide. And so in general, it's about 6 or 7 days. It's up to 14 days, as low as 3 to 5 days. We find that most dogs in about 5 days, 5 to 6 days after exposure typically get sick, but there's a wide range. It's important to recognize that range that's described, because if there's ever an issue with a puppy and a breeder, they'll say, well, look at the interval from when they were exposed to when they developed disease. And most of the time it says 7 to 10 days, but we do see it as soon as 3 to 5 days, and 5 days is pretty typical for what we believe that we see. In terms of how well these puppies will do, if we treat them, I talk about the Cadillac plan, which is a very dated expression, but if people go for it for therapy, we get almost 90 to 95% of the patients out of the hospital. I tell people 80. but we generally, I think we do better than that, closer to 90%. That's with appropriate care in the hospital, for about roughly 5 days of care in the hospital. And so, if it's a virus, it is a virus. It is a virus that has a tendency to go and hang out and reproduce in the most rapidly growing cells in the body. And so those are in the bone marrow. So the bone are the cells that are dividing in the bone marrow, as well as the intestinal, the crypts. So you've heard of the villi and the crypts. So the crypts divide the rapidly dividing cells of the intestines, and so those are the tissues that we see results of illness first. So we see them have horrible vomiting and diarrhea, and not necessarily bloody. Only about 30% to 40% will actually ever have bloody stool, but when they have it, you can smell it in your neighboring county. Almost all dogs have vomiting to some degree. Where was I? So treatment for it. So the treatment for it in general is, let me finish up. So diarrhea, vomiting, and we see that almost all the dogs develop very, very low white blood cell counts because the white blood cell lineage in the bone marrow is the fastest growing and has the shortest half-life in the bone marrow. So when these puppies present, it's almost always vomiting and diarrhea. It's usually acute, but it doesn't have to be acute. The things we know that are risk factors for getting parvo are crowded housing, and puppies are like gang housed, and intercurrent parasites, hookworms, whipworms, giardia. All of those are risk factors for getting parvo, but they don't impact the ability for those pets to get well. It doesn't have a prognostic implication. And so the test for parvo, this is an important thing. The test for parvo is on poop. It's a test. And so what it is, it's an antigen test, meaning the test actually finds the organism. The test isn't detecting the antibodies, the test is detecting the actual presence of the parvoviral antigen in the feces. Well, the reason that is maybe important is because it's hard to really, the question becomes, what if a pet was just recently immunized? Can you get a positive test, a fecal antigen test from the vaccine? And the answer is yes, you can. It doesn't matter, I don't know what the frequency is, but people will say, oh, it's a false positive, it's a false positive. That's not right, that's not correct. It's a true positive. The test is doing what it's supposed to do, is detecting fecal antigen. So the fact that it detects some of the vaccinal antigen doesn't mean it's a false positive. It's a true, it's not a false positive, it's not an error on the part of the test. Most of the tests, however, it has, if they were just vaccinated, you can potentially get a weak positive. And the thing is, I sort of talk out both sides of my mouth, because either it's positive or it's negative. People say, oh, it's a weak positive. I'm like, you can't say, oh, it's a little positive. It's like looking at a test saying, oh, she's a little pregnant. It doesn't work like that. However, with vaccinal positives, when we get that, because it becomes an issue again with breeders and people who sold the puppies, they'll say, oh, it's just because it got the vaccine. Fact is, maybe, even if it is, the dog is sick, it has vomiting and diarrhea, we're gonna treat it the same anyway. But if that ever becomes an issue, yes, it is possible that some of the vaccines might cause a false positive. It is generally not one of those like those bright blue spots you see when they're positive. I just want to put that out there. And so when we diagnose them, a couple other things are important, is that parvo puppies, if you diagnose them early, a lot of them will have what I call like a honeymoon period. Most puppies, once they start with the disease, this isn't all of them, but 80% of dogs that are mildly affected will get worse before they get better. In other words, we can set them up to do well. We can make sure that their fluids and their hydration is all well done, taken care of, but it doesn't mean that the disease is not going to run its course. There are some dogs that do have quote-unquote mild forms, but most dogs will actually, that they will seem to have a mild form of it. They'll play with their food and stuff, and then the next day they'll look really awful. These are just practical things you won't see in textbooks, which is why I mentioned it. The hallmark of treating these dogs, and so the most important thing, these dogs come in with number one, horrific losses, both from their vomiting and from their diarrhea. They come in extremely behind on volume, often. And many of them, not all of them, but many of them are really painful, and we need to really acknowledge that. And there are some that just don't become painful, and some, if there's any question, we should manage it. And so, if someone said, if we could only do one thing, most puppies, if we got their fluid therapy right, most puppies would do great, even without all the other things that we do. And so the most important thing is, number one, these are dogs, if you're gonna, we can talk about this, these are dogs that need to be really careful. These dogs should, ideally, they have no white blood cells. It would be great if we would wear gloves, or at least really wash your hands thoroughly. These are not, it would be great if we could put sampling lines in these dogs. It is in my mind, a contraindication to place a sampling line on a Parvo dog. They are known to be hypercoagulable. They clot the line all the time. And if you've ever drawn blood from a Parvo puppy, if you don't immediately rock it, no matter what it is, you'll notice that Parvo puppy's blood is very clotty. And so, in general, you don't want to give them a risk for having a thromboembolism, and so we try not to put sampling lines in puppies with Parvo, and this has been looked at. But certainly, as a peripheral IV catheter, in terms of blood work, I don't do any blood work on them, and I will do, it depends. If they're really young, like less than 2 months old, I'm more cautious. They don't, the things that I would look at would be, if I was going to do blood work, they all become neutropenic. And if money is no issue, I would run a CBC and electrolytes and a blood glucose. But they don't need full blood work, as far as I'm aware. I've never felt I need to do it. And when money is an issue, I will not do any blood work, including a PCD or a blood glucose, because you don't need it. And that's just me, that's more for doctors. And for you guys, I just have never felt that I was glad that I had run full lab work on a puppy. Having said that, if I feel there's other things going on, if I feel that they're showing signs of neurologic disease, they may have distemper or something, that's another story. But if they're Parvo, I generally don't. And so, the most important thing that for you guys as nurses is, number one, be really careful with placing an IV catheter, because they almost always have no neutrophils. And it's not uncommon for them to come in with 200, normal neutrophil count in a dog is like 3,500 to 8,000. These dogs come in, 700 and 600. It's not uncommon. Most of them rebound. There's really no evidence that giving them anything to kick up their white blood cells. They almost always rebound. And so once they're getting better, I don't recheck them. And so I don't recheck them in the first place. But if it's a really tiny puppy, again, when I say, if this is a Yorkie or a Maltese where you sneeze and they become hypoglycemic and fall over, those are dogs that I would be checking glucoses on. And if they're really under 3 months of age, I would check blood glucoses on them. For me, we can check it, but I generally will put them on. If I'm worried, I will put them on a really low percentage of dextrose, like 1.25%. Ideally, you would check it. I just don't stick these puppies unless they're really tiny. I don't stick them unless they're recumbent or really small. And so one is fluids. Now, the fluids that with these puppies are almost all of them become hypoketotic. Their potassium goes down. When we resuscitate them when they first come in, we don't give them potassium-containing fluids. The other thing I'll tell you is, as a nurse, if you're not here, you might work at a hospital, they use lactated ringers, but some place might use Plasmolite, and some place might use Normasol. And so there are very subtle differences, but there's no difference. Like if someone, it's never really a problem with, there's no, in other words, doesn't matter. All of these are balanced, buffered, pretty much isotonic fluids. The fact is, or if they chose saline, that would be fine too. We don't use a lot of that. So any of those fluids are completely reasonable to bolus them with. We just don't add potassium. So we do add potassium afterwards to these pets. In general, though, there are studies that have shown that although they all become hypokalemic, how well we manage their low potassium doesn't seem to have any bearing on their outcome. It doesn't mean I wouldn't do it. So initially we do this. It is not wrong to use other types of fluids. If they're really, really in bad shape, we can use hypertonic saline or colloids. It's very uncommon that we find the need to do that. So the other thing that is really relevant to treating them is nausea. And so treating their nausea is important. And some of these dogs are not only nauseated, but they're painful because their stomach is so distended with fluid. And so in terms of drugs to treat it, I don't know that we need every drug, a lot of them. The typical drugs, just so you know that, the ones that, none of these are wrong or right, but when you can use one or two or all of them. So the first one that most of us will use, I should say that most of us will use, especially if it's a cost issue, would be Zofran or Zofran. Good thing about it, inexpensive. It is both antiemetic, so it stops vomiting. It is also an anti-nausea drug, which is important because they don't all do the same. And so this both controls the sensation of nausea and also controls the actual active emesis. And so it's a wide range. We usually give it IV 3 times a day. The dose is anywhere from 0.2 to 1 mg per kid, but we generally use 0.3, 0.4. And it is effective in some, but not all animals. I don't think it is as effective as it is. It works. The other one that everyone knows is Serenia. So Serenia is once a day. I've used it in super young dogs. I don't know what the rule is. Serenia is a really good drug to control vomiting. Its mechanism does not really allow for controlling of the sensation of nausea of itself. And so it seems to be an issue more for me than other people, but it's a really good anti-emetic. And whenever I have a patient that's been given Serenia and more than 2 hours have gone by and they're still vomiting, to me, if it's an older dog, it's concerning. It's such an effective anti-emetic. It's very uncommon for us now to see dogs that continue to have vomiting and retching after they're given Serenia. And we can use it in puppies very well, easily. I mean, the other drug that anti-emetic that we use is a drug that is called Renal or metoclopramide. Now, metoclopramide. So this drug has been out since before God lost his shoe. This drug has been out. Since when I was a kid, working in animal hospitals. So it is a very good drug. It works peripherally, in other words, in the GI tract and centrally. It also works in the chemoreceptor trigger zone. In dogs, we have a choice of how we give it. We can either give it 3 times a day by sub-Q injection, which is fine, but I don't think if you have a dog that's really dehydrated, I don't think it's probably a great way to go. We tend to give it in the IV fluids as a constant rate infusion and with their IV fluids. The thing that, and I don't know how well it works, but I think it is a helpful thing in these puppies, because they develop such profound ileus. Their stomach and their small intestine just sits there. There's no peristalsis at all, which is why we find ourselves placing NG tubes in them. So I don't use the metoclopramide so much because of its anti-emetic properties. I use it because it's a prokinetic. So it has some cholinergic effects. So metoclopramide will actually help to establish normal contractions, normal peristaltic contractions. It tends to open up the pyloric sphincter and tends to promote normal motility of the intestines. It's a weak effect, but tends to be why I'd be more likely to use it. What I will say about metoclopramide that it is always given, the dose is 1 to 2 milligrams per kilogram per day. In adults, I always use 2 milligrams per kilogram per day. There are 2 situations in which I use 1, and that is puppies and renal failure. And so the reason being, and I've just seen this happen a lot, is because one of the earlier effects of animals with either renal disease or juveniles, it's called these extrapyramidal signs. You'll walk into the room and they sit there like this. And so what we used to do is erroneously conclude that these puppies had distemper and write them off. But it was actually an effect of the metoclopramide. And I don't know the exact mechanism for it, but when in puppies I will tend to use 1 mg per kg per day. I don't know the efficacy of that, but I do. But it is still within the reported effective dose range of the drug. So the other things that are important are pain, so analgesia, and these are dogs that I tend to. Here's a real red by the wrong answer. For me, and I fully realize that it's my own. I don't give hydro to anything, but that doesn't mean it's not the right thing to do. And I think that if you get on top of these dogs early, you can get away with buprenorphine. Buprenorphine in dogs, is a drug that is an reasonably effective analgesic. It has to be in their system before the painful stimulus. So it takes, no matter how you give it, intraspinal, intrathecal, in their eyes, in their vein, it takes 25 to 30 minutes for buprenorphine to take effect, which is why I try to discourage the emergency doctors for using buprenorphine as part of their drugs to unblock a cat. So it takes that long in cats as well. In cats it works great no matter what, but in dogs, if you start them on it before they're super duper ouchy, I think it's very reasonable to use. The other thing I like about buprenorphine is it does not affect motility. Most of the opioids that we use, they are mu agonists, and so as a result, they will cause some ileus in and of themselves. And so I think buprenorphine is actually, it works. I wouldn't wait, if you're gonna wait until they're painful to be on, really painful, I don't think buprenorphine. It's a very poor drug to play catch up in dogs. But it's fairly inexpensive, does not produce a tremendous amount of sedation, and the analgesia that we're worried about is their gut. So it does provide good, not orthopedic so much, but visceral analgesia. I think it's pretty good for. There are other things to do as well. And so the other thing to do, even though it's a virus, is antibiotics. And there are studies that show, and there's many of them out there that show that the morbidity meaning the clinical signs of parvovirus in dogs are largely due to the effects of bacteria. It's a virus, but bacteria are actually responsible for the clinical signs that we see. And they've done some fairly elegant studies. The most one they did when I was at Penn was they took puppies that are called notobiotic puppies, and these are born with no immune system essentially. And then if they took puppies, if they took puppies and they didn't have any bacteria, and they inoculated them with Parvo, then they took normal puppies that had normal bacterial flora, and those puppies all got sick. But the puppies that did not have that were born without any kind of natural flora did not get sick. And they've shown other things, that the morbidity of this disease is directly associated with their bacterial load. And so I don't think the antibiotics we choose, it's doctor dependent. I think a lot of doctors might choose a drug like Baytril. It's okay. The reasons we don't use it is because there is some concern over of large breed dogs developing cartilage abnormalities on their joint surfaces if you use Baytril. There's no real good evidence that this occurs at dosages that we use, but if you have a dog that's like a Shepherd or a Malamute or a Malinois or something, I might think twice before doing it. It's also not necessarily, in my opinion, not a drug that we need, because what we're trying to get, we're not worried about staph and strep, like normal things you get in urine. We're worried about things that are in that gut, like anaerobes and gross gram-negative things. And so Anyway, I think as long as they're placed on antibiotics, they generally do okay, but I do think it's important. If you don't put them on antibiotics and you get the rest of this all right, even without antibiotics, most of these dogs are gonna do well. I just wanna point out that I think that bacteria are responsible for a lot of the illness that these dogs show. And so I would still put antibiotics here, I guess, at the discretion of the veterinarian themselves. And so there are other things that I would include on this list, and the other one is nutrition. Now, it has been shown pretty well that early enteral nutrition, providing nutrition early on, is associated with resolution of more rapid resolution of clinical signs. I don't think it's associated with earlier discharge from the hospital, but it is associated with more prompt resolution of clinical signs. So these studies, what they've done is they've placed a nasogastric tube in these puppies, and they will feed them, there's different ones, AD and other blenderized diets, and even if they'll sometimes even feed them through vomiting as well, and so that has been shown. I don't do that as much. I should do that a little bit more, but the puppies are kind of far away from where I am, and I just feel they do relatively well without it. The other thing that I will tell you, this is not anywhere you can find it. There's no question on how I would ever do the study. If you want to talk about getting them home and better soon, they have to walk. You won't read this. And as Whitney will tell you, this is the cue. You can't leave them in their cage the whole fucking time. You have to get them out, put them on the floor, and make them walk. You have to make them walk and walk around. Why? It's the only thing in my head. It is the best thing to get their GI tract up and running. The same is true, by the way, of puppies with pneumonia. If you leave you could coupage them all you want. If puppies with pneumonia are allowed to walk around, they get better faster. But with parvo puppies, there's no question. So I'll put a thing, I put in the orders, make puppy walk around room, and people are like, oh my God, that is what I truly believe is as helpful as everything else. So it is expensive to treat. Why is it expensive to treat? Because of the nursing care. So people say, well, why is it so expensive? Well, the drugs. If you've ever taken care of a parvo puppy that weighs any more than 20 pounds, your entire hospital smells like a sewer. You have to change your clothes. You can't touch any other dogs. You're gonna have a tremendous amount of laundry and disposable stuff. You need to keep these dogs clean. And it is a tremendous drain on nurses if you have more than one or two of these dogs. And so the cost of treating them is high, but I don't think that we are overcharging for what we do. And so I will also tell you that most people would check their white count when they came in, and if there was not a money issue, I would check their white count initially, and I would check their electrolytes. But as long as the pet is improving, the only time I would check any blood work is if the pet I felt were declining. And then I would go back and make sure electrolytes and blood glucose were okay. So I think that the other thing that you should be aware of for cases that are financial is there are several protocols described for outpatient management of parvo. And so we've tried, the reported success rate is pretty high. It's like 75 to 80% success. And for us, the way that our fee schedule works and the way that our hospital works and that most referral hospitals work, the effort on our part is pretty great. And if you really look at what we charge for what's part of that therapy, it doesn't work out. In my hands, it's not been as successful, although I fully admit I may have tried it. And so, what does that involve? The outpatient. Initially, the outpatient, what you would ideally do is you admit them, you give them up, you get them volume replete with fluids. They're given Serenia and Convenia and glucose, and then they come back at different intervals. Most pet, ideally some of the protocols require them to get sub-Q fluids up to every 6 hours. Some they come in daily. We used to do this, it was like Parvo, we call it Parvo, because they just pull up their car and just go out there with, with fluids and stuff. But so it is actually absolutely discarded. I think it is much more relevant in a situation like a shelter type environment. I don't think that on balance, financially, it is a big difference. I'm happy to share the protocols with you, but I don't think that it is in my hands just not been as rosy as other people describe. The other thing that we do, or that I think is effective in these puppies for treatment and for alleviation of discomfort is, and it's not every puppy, I think about 1 in 3 of these dogs feels better with a nasogastric tube in them. And that is because if you ever saw these puppies, when they're really painful, and anyone who's been taking care of them, when you're nursing them, they are, no matter what you give them, they're still super painful, like they're wobbly and they're like this, and they're miserable. And they're miserable because they have all this fluid in their stomach that's refluxing constantly into their esophagus. Their esophagus is parallel to the ground. Ours is up and down. If you've ever had reflux, it's horrible. Can you imagine just having that, constantly having that going up into your esophagus? And so I have videos that I've shown the nurses here where we place a nasogastric tube in this puppy, and it's like this, and you start to remove the fluid, and the puppy falls. It looks like the puppy died. It just flops over. And you know why that is? It's the puppy sleeping. The puppy hasn't slept in days, and it's been miserable. You finally pull off this stuff, this sympathetic, they're in such sympathetic overdrive, if you think about it. The more painful they are, the less likely that they're empty. Because to empty your stomach, it's a parasympathetic function. It's like a baseline. If you're painful, that will prevent you from emptying your stomach, because you'll be in such sympathetic overdrive that you can't empty it. And so I have a couple of videos of puppies where we start pulling the fluid off, and they literally fall over, and they're not dead; they're just sleeping. And the same thing is true. I don't know if you guys saw. I think we underestimate how exhausted animals get. And then, in general, what we do with them, if anyone has any questions more about this, what we do with them in terms of getting them home, I never send home any GI drugs with anything. And so I've never, in 25 years, I've never sent a Parvo puppy home on any medication except a dewormer. I know people send them home on famotidine, Serenia. I think, I'm not arrogant, I've been treating this a long time, I've never sent a Parvo puppy home on anything. Once they're done, they're done. And once they feel good, once they jump up and eat some food, they're done. Whether they're on 1 medication or on 6, once they jump up, they're eating food, you leave them on food for 6 hours, pull them off all their meds, and you send them home. And I'm not saying it always works, but I've never, I don't send them home on anything. They don't need antibiotics. And why? Well, they just don't. And if you look at their white count, by the time they go home, if you check it, their white count's in the 30 to 40 to 50,000 range, because their bone marrow was able to kick it out. Nutrition, what I tell clients is if they're gonna go home, and this is for nursing, so you need to tell clients this, because everyone has this. I tell clients, you and your kids have to suppress your internal Italian grandma, because your puppy's gonna be screaming and screaming and screaming and screaming to be fed. And what I'll tell you, if you let these Parvo puppies eat an entire bowl of food, you set them back. You absolutely set them back. What do I tell them? I say, show me what you think of it. Like, make a couple of meatballs, and I tell them it's okay, your dog is not gonna starve to death. Start with a couple of small meatballs, maybe then more, and then every 4 to 6 hours, give them a couple of meatballs of bland food. The next day, 50-50 with their regular food and then some bland diet, and by this 40 hours later, they're back. I pat them back to transition. I think bland food, small amounts, and everyone, but the problem is if you have a household with 6 people, everyone walks in, like, oh my God, he's starving, and everyone grabs some food and feeds to the dog, and everyone's like 15 minutes later. And it's human nature. We all want to give puppies food. But I would say that let them run around. They should be made to walk around, and I think they get better. The nasogastric tube, we do keep them evacuated, but it's not most of the time. I think it's the rare, it's not every Parvo puppy that it is appropriate for. But so the reason why I love this disease, just from a philosophy, just from in general, is if you look at it, think about what we treat. I don't feel great about sending home a dog on medication for Cushing's disease, or diabetes, or chronic progressive bronchitis. Why? Because everything we treat in veterinary medicine is by definition almost progressive, or ongoing, or degenerative, or whatever. Fine, but I don't feel great about it. But a puppy, this Parvo puppy comes in, it's horrible, it's sick, it's septic, and when it goes home, you never look back. This is a dog that came in as a puppy, it's leaving as a puppy, it never looks back. There are no consequences of parvoviral infection. They never look back. These puppies go home, they're doing great. And so they need care. You did that, but you're sending home a puppy that has it has a life ahead of it it's not gonna be on insulin and trilostane and potassium supplements and blah, blah, blah. Those dogs do great. And so for me, when those dogs go home, it doesn't get old. I just love seeing those dogs go home. And I think if you, truly, I think these dogs, the nursing care, I cannot tell you how important that is. They need to be kept clean, and and the other thing about these dogs is you need to also resist try not to place catheters in their back legs, because they're already gonna get crap all over their catheters. And so you try to avoid placing saphenous catheters in these dogs. We don't place central lines unless we have to, because they're clotty, and they generally do really, really well. They are probably, if they never got vaccinated again, they probably are immunized for their life. We still pick up with their vaccine, so we'll say, okay, once they get better, we'll have them start the vaccine. They'll have them go back in like 10 to 14 days and pick up where they left off with immunizations. And there are other things that people talk about treating them with. There is some reasonable evidence that treating these puppies with like plasma from dogs that have recovered from Parvo, they may do a little bit better. In general, that's true of every disease. Puppies love plasma, but I think that it is most dogs, and if dogs are not getting better, it is, the thought is that you also treat the parasites, and then I can't tell you the last time, what I was taught is that when puppies aren't getting better, if they're painful, it's likely that they have an intussusception, which is a telescoping of their bowel. I haven't seen a Parvo puppy with an intussusception. I don't know, it happens. It's been many, 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 many years, and so typically those will be the dogs that also have other intercurrent diseases. As I said, potassium supplementation, I would say this, if in general, you've all seen that chart that says if the potassium is this, add this, if the potassium is this, add that. It's called the SCOT. Just remember, if you have that chart is assuming that you're giving fluids at a maintenance fluid rate. So if you have a Parvo puppy that weighs 10 kgs and it's on 50 mils an hour of fluids, the dog will probably be fine if you do it, but that chart assumes that you're giving fluids at maintenance, like 2 mils per kg per hour. So if you're going to supplement fluids with potassium or anything else really, you have to just account for the fact that it's going at a rate that is faster than that table accounts for. As long as they're peeing and pooping and it's very hard to overcook them with potassium. I'm trying to think if there's anything else that we sometimes do. Anyway, I don't, with things that are not in textbooks, they need to get up and walk, even if they don't want to. They feel better, they get better faster. Any questions about, I'm trying to think if I'm forgetting anything. Yeah, and I think that, fluids, I'm telling you, if you just give them enough fluids, it's 80% of the battle, I believe. And I think that if we wound up never giving them antibiotics, I don't know how much of a difference it would make. But the important thing to know is that your GI tract is sort of, if you look under microscopically at what your intestines look like, this is your intestines, and this is where the ingesta goes through. So you have these villi here, but if you look at this is all gone with Parvo. It's gone. And so when that And then, so the point being is that this area, that all of it is thought that it's not really the true term that we get translocation. So there's this whole mucosal serosal surface is disrupted, and so you get translocations. So, bacteria will move across the mucosa and wind up in the vasculature and develop, the sepsis, and so that is why we do tend to use antibiotics. I don't know that. We haven't looked at it. I think that I believe these puppies would do well. Most of them would do really, really well with just the appropriate supportive care and cleanliness. Becky, is there anything else you would add?
No, I think that's thorough, thank you.
Yeah, and anytime, I'm always up for answering questions about Parvo.